then we've brought two speakers to give us community highlights about the work that's being done right now. So I'll just go through and introduce each of our speakers, and then we'll get started. So our first speaker today is going to be Elissa Unger. She's PAVe's Education and Grant Program Manager, and has an extensive background in mental health, community health, and parent education. She has worked for several organizations providing health education, mental health services, and disease prevention. Elissa is passionate about health equity and youth mental health, but understands the vaping issue from a personal parental point of view. Elissa holds a master's degree in public health as well as psychology, and she is the mom of 2 adult children, 19 and 22. Thank you for being here, Elissa.
Hi, everyone. Thank you for having me. I'm not sure if I can share slides yet. If I was given that permission, I don't see that I can.
Let me work on that real quick.
Okay, I'll just start talking a little bit then. So again, my name's Elissa, and I am with PAVe, Parents Against Vaping E-Cigarettes, and I've been with them just over 2 years. And so my role as the education manager is working on developing our education programs and working across various communities and really developing our parent education, as well as our Train the Trainer, which, you know, Kentucky is a great partner of ours for that. Okay, 1 second. There we go. All right, here I go now. Just 1 second. All right, now we're in all set. Thank you. Okay, so again, Parents Against Vaping. Really, if you don't really know much about Parents Against Vaping, we really focus on adult education. We don't really focus on youth prevention measures at this time. We are developing those, but we also, though we educate adults, we don't focus on adults who vape. That's not really our priority. Our information that we use is based on the latest science and research from public health experts. And again, our goal is to protect youth from vaping and nicotine use. So PAVe started as a small group of angry, committed moms, but we have grown into the national parent voice on the youth vaping epidemic, largely via volunteers across the country. And if you're not familiar with the backstory on PAVe, I'll just share quickly. So our co-founders it was 2018, found out that a Juul representative entered their 9th grade children's classroom and basically was giving a health presentation. But at the end of the presentation, made claims that though the FDA hadn't approved Juul, that they would shortly, and that it was completely safe. So when our founders learned of this presentation, they started looking into the issue more and realized that you know, the Juul products were not FDA approved, and then that's sort of how PAVe was born. So we do share some statistics anytime we do presentations. So the National Youth Tobacco Survey reports that in 2024, over 1.6 million kids are vaping in the middle school and high school ages. Now that number does show a decrease from the 2023 survey numbers, but it's still a very large number to be looking at. The survey also does report that students are using more often. So 29% of youth reported frequent use and 22% reported daily use. So that is indicating that, you know, there's the strong nicotine addiction factor with these vaping products. And so though we've made significant progress over the last handful of years, we do still need to stay vigilant because of the vaping. The products continue to change and continue to be available to our youth. The survey does also report that more than 1 in 4 use daily, and those 90% of users are using those flavored products. We at Parents Against Vaping are trying to give a voice to parents and families who have been affected. We do that by getting families to share their stories, Through our advocacy team, we collect stories that have been influential in helping pass laws in communities. We educate parents and other adults who touch the lives of youth and advocates across the country. PAVe has been part of very successful campaigns to get legislation passed across the country, and we continue to grow our volunteer network. So when we do our education programming, we again are looking at educating adults. And so we offer an opportunity for parents and adults to get involved in educating in their community or engaging on social media. We do also have materials that are currently available in Spanish. Our main presentation we call the core presentation, and you can see on the slide, these are the topics that are discussed in that presentation. We do share a history of PAVe, all about the marketing tactics that targeted our youth, as well as health harms and ways to support youth in either quitting or making better decisions. And now currently what PAVe is doing is we are offering live national quarterly presentations, which you can find the schedule of those events on the PAVe website. So after our core presentation, participants will be able to understand and recognize tobacco industry tactics, explain the dangers of using e-cigarettes and other tobacco products, which now we talk a lot about, like the Zyn and the pouches, because those are becoming, unfortunately, quite popular. We also now are expanding our information on cannabis and how that is now crossing over with the vaping use. We do talk about non-nicotine vapes, because those do exist for youth. And we talk about how to protect the youth in your life, and then how to be empowered to take action in your own community. So PAVe does provide training to community members who then can use our materials to educate in their respective communities. We have created an online toolkit with materials that anyone who's trained can access and use at any time. And all presentations and materials are updated at least twice a year. We do have the Train the Trainer program. And so this is the program that developed our relationship with the Kentucky folks. So this program, can train larger groups of folks, public health or educational professionals. And then with this training, they can continue to spread our message through training others in their communities to provide the presentation and the materials. PAVe has recently launched a new webinar that's directed at school administration to discuss the importance of non-punitive practices relating to students and vaping nicotine on school grounds. We at PAVe are choosing to use the umbrella term alternatives to suspension, which focuses on supporting the student and providing them with needed resources after they break school policy. By implementing supportive disciplinary practices, districts support recovery from tobacco addiction and give students tools to resist the peer pressure to use tobacco products. With this program, we have created an extensive list of resources to help implement restorative practices in your school or district. We also share tools for districts if they want to create new policies. So our website holds a whole list of the resources related to school policy. PAVe is also active on the advocacy side, as I said earlier, and continues to be a voice nationally as well as in local or regional legislative battles. Parents and kids are the most powerful voices that we have in this fight, and we give parents a voice in their communities to fight back. We sit down with them, help them write their stories, get them comfortable to share their stories, and we hold the hands of parents and families so that they can make their story and struggle as impactful as possible to help pass policies. We also do editing and recording, rehearsing, and so on, so that our parents become comfortable and are willing to share this full story. So despite the fact that we have enacted legislation, even specifically in New York City, where PAVe is located, the jurisdictions across the country, so the problem becomes enforcement. So laws are passing to get these products off the market, but the enforcement is lagging behind. And so in response to inadequate enforcement of these laws, PAVe created the program called Poison, Parents Opposing Illegal Sales of Nicotine. And we first piloted this program in the New York suburbs and then further developed it for New York City. We continue to work to expand this program in other locations and are working on a collaboration currently in Nevada. Poison empowers parents to report violations of e-cigarette laws through a simple smartphone tool. These reports can lead to store inspections and violation fines, and sometimes even store closure. This program does make parents and others feel that they can make a difference in their communities as it relates to the illegal sales of nicotine products. So as I had said earlier, PAVe is really started as a parent-to-parent organization. Now we educate adults, legal guardians, professionals, but we don't really target youth except for our Vapes Are Trash program. And this really started as a social media campaign a few years back. It is getting new life this year and with some funding from New York City Department of Health. So it's very exciting, but really the basis of the Vapes Are Trash program is trying to get youth to be passionate about the issue of vaping from an environmental standpoint. So this was created for teens and continues to share social media. We have created presentations related to this that's actually we're developing for adults as well as youth, just to try and take a different stance on the vaping issue and get people to see it also as not only as human health harms, but as environmental harms as well. And these are just some of the posters that have been created for Vapes Are Trash. These are available on our website. We just launched a new vapesaretrash.org website. So those materials are on there. If you need something from these programs, you can feel free to reach out to me and I can share materials with you as well. And finally, we at Parents Against Vaping have created a parent support group on Facebook. And so currently I think we have 700, parents on there. And, we really want to have this be a place where parents and adults can come together and talk about their concerns. It isn't it is moderated by us, but we're not really involved. We don't often respond. We really want it to be a parent-to-parent support system. But again, we are looking to expand this and bring in maybe monthly or quarterly live presentations or Facebook Lives with professionals and experts to continue to provide support to our parent network. And then, finally, really, these are the places that you can find us online. Our website, we are on Instagram. We are also on Facebook, X, which was Twitter. And again, like I said, we also have the new Vapes Are Trash website as well. So that is a very quick and example of PAVe. And I'm happy, I don't know if there's questions now or questions later, but I will put my email in the chat. And if anybody has questions after this presentation, feel free to reach out and I'm happy to help. Thank you.
Thank you so much, Elissa. No, that was great. And if anybody has any immediate questions, feel free to ask them now. Otherwise, we have plenty of time at the end for Q&A as well. If there aren't any questions, I want to say a little bit more about the work being done with PAVe in Kentucky, and then if questions come up, feel free to put them in the chat. And then again, we'll have some Q&A at the end. But I wanted to provide a bit more context to the Kentucky specific work before we introduce our next two speakers. So the overview is the Department for Behavioral Health, Developmental and Intellectual Disabilities Prevention and Promotion Branch and the Kentucky Department for Public Health Tobacco Prevention and Cessation Program began collaborating with Parents Against Vaping E-Cigarettes National Education Team in January of 2023 after parent education was identified as a priority prevention need for the state of Kentucky by a multi-sector statewide youth vaping task force. So the Beaded Prevention and Promotion Branch contracted with PAVe, the PAVe National Education Team, in June of 2023 to have staff at each of Kentucky's regional prevention centers trained and certified as trainers of the PAVe core parent presentation, which Elissa talked about in her presentation. So in this trainer role, the Regional Prevention Center staff can recruit, train, and support community educators who then go on to deliver the PAVe core presentation to parents and trusted adults in their communities. So to date, Regional Prevention Center trainers have trained 120 community educators to deliver the PAVe core presentation to parents and other trusted adults in their communities. Many of these community educators are local health department staff recruited through the DPH tobacco program outreach. And one update that we do have is in February of 2025, Kentucky's PAVe education will expand to a 3-tiered system. The PAVe national team will train 30 master or super trainers from organizations and groups across the state. And these super trainers will be able to recruit and train trainers. This means that starting next year, we will have a complete system of trainers within Kentucky. So we'll have the master trainers who prepare and support trainers, and then trainers who prepare and support community educators, and then the community educators who will go on to deliver the PAVe core presentation to parents and other trusted adults in their communities. So if you are interested in being trained as a community educator, I'll put a link in the chat to get in touch with the Regional Prevention Center in your region. And then if you're interested in trainer training or the master or super level training, or have any other questions about PAVe education in Kentucky, you'll have Elissa's email in the chat, and I'll also put in Tara Rukert's email in the chat, who has been the point person for this project. So with that being said, we want to hear from two of the regional prevention centers that have been doing this work with PAVe to share some successes and community highlights. So we'll start with Kaitlyn Slaughter.
Thank you, Alexis. So I'm going to share mine. So I am the director of the LifeSkills Regional Prevention Center, and we have been working with PAVe for a while now. We began with a PAVe social media pilot, our LifeSkills region did. So that's probably our biggest success with PAVe. It was something we're super proud of. With it, we were able to spotlight 2 of our own volunteers from the LifeSkills region who actually work within the school system that see the effects of vaping on our youth. And they were able to actually create 3 recordings each that spoke on how dangerous vapes are, how they are affecting our youth, how easily attainable they are, because of course high school kids talk, middle school kids talk, they tell you where they get them. And they really spoke from their heart and told us why they think they're so addicted to youth, and that how the youth don't even realize how addictive they are. One of these videos is Shelly Thomas, and I'll show it at the end, but it just shows you, she's a Frisk in Barron County, which is one of our counties. It just shows you how much she really cares about the health of the students and how much she knows that it is really affecting them. So when you look at the numbers of what all we have done, quantitatively, like Elissa spoke, we've been doing PAVe training since our staff has been able to get trained and do it. We've been able to train 65 individuals. And I know that doesn't seem like a very significant number, but this encompasses a lot of individuals from many different areas. So it includes community partners, parents, school employees, there's Frisk. We have district health department employees. We've been able to train a Kentucky State police officer, prevention specialist, and then there's many, many more. We are in constant contact with Tara Ruckert at DBH. She's been able to connect us with the Youth Vaping Task Force, and we were able to get a large number of those individuals trained in PAVe during one of those monthly meetings. The LifeSkills RPC has also been able to host the PAVe trainings at one of our quarterly regional prevention leaders meetings. And this was actually one of our larger quarterly meetings that we have. It grew in very large crowd, more than normal, because there's such a desire to learn about what can we do for youth related to vaping and helping them. So it was really receptive, and they liked it. The adults liked it, liked learning about it. So related to the numbers in reach, when we did the PAVe social media pilot, we were able to post these videos to Facebook and market them in other locations. So the reach we were able to gain just from posting them to our personal LifeSkills Regional Prevention Center page was over 22,000 posts over just a 15-day period, or views over a 15-day period. And we know these numbers are going to grow over time with the individuals that we train. I actually have a training scheduled next week, and we know we've got more individuals who are interested in the PAVe training. On this slide, this is a little infographic that one of the staff members here at LifeSkills created. And it's just something we've been able to send out to parents. Hey, if your child is vaping or you think they are, here's some ideas for it. Here's some solutions for it. Here's My Life, My Quit, PAVe, Truth Initiative. You just simply scan that QR code and it takes you straight to that link or that website, and you can learn a little bit about it. Or the kid can do it, the parent can learn about it. If you want the child to learn a little bit about it, they can do it too. And it just lets them know. And then that is all I've got, and I'm going to show you all the video really quick.
Hello, I'm Shelley Thomas. I'm the Youth Service Coordinator, Barron County High School, Barron County Trojan Campus. I can speak very frankly and tell you that our youth are addicted to nicotine and other things that are in vapes. Their mind is thinking about the next time that they can get that nicotine buzz that their body is craving, and that is part of that addiction piece. So just being a support system and helping us with our students is key and pivotal. It's going to take all of us to combat this, and I thank you for your time in letting me speak about this subject. Thank you.
Okay, and that is my little piece from LifeSkills. And I'm going to do, like Elissa did, I'm going to put my email address in the website because I cannot stay for the whole entire meeting. Alexis knows, but if there's any questions, please feel free to email me because I would be more than happy to let anyone know about our initiatives or anything that we've been doing.
Thank you so much, Kaitlyn. Thank you for being here. Yeah, and we're just so excited to be able to highlight the work being done in the community. So I appreciate it. And if anybody has any questions for Kaitlyn, you can put them in the chat or let me know since she does have to leave. And then Kaitlyn will keep you updated on the Q&A. So thank you for being here.
Thank you for having me.
So now we'll move on to another community highlight. So we'll hear from Kayley Edelen.
Hi everyone, my video is not going to work unfortunately, so we're just going to have to bear with me together and let me share. Let's see. You all are seeing it full screen, right? Okay, perfect. My name is Kaylee Hayden. I'm with the RiverValley's Regional Prevention Center. I work as the collaboration specialist. And whenever we got presented with this PAVe information, we were like, finally, this is something that is obtainable, tangible, that we can bring back to our communities and really be a connection piece with the community members, but for the nicotine information that's already out there and resources that they can get at their fingertips. So we were very, very happy and fortunate to be one of the sites that got the trainer of trainers. And so we do have a couple of successes so far. We have trained 27 people, or just community partners, so far to become PAVe trainers. And one of the highlights was one of the local Davis County judge executives was part of one of the trainers. And he kind of just led with it. He learned about everything in the training, and he's a huge proponent for it. And he was able to take this information not only back to his family, but he actually talked about it in a staff meeting with all his employees. And it just opened a window for an opportunity to help change the, I guess you could say, the trajectory or the environment of nicotine products in our community. We are really excited. Every single person that goes through this training with us, they are very surprised about the marketing towards youth that's happening. It's almost like we became numb to what's happening. And whenever we pinpoint it and get those pictures up on the slide, they sit back and realize, wow, this is actually happening. This is a serious matter. We do need to put our heads together and really lean on each other to provide these resources to those who are in addiction already, trying to quit or being lured in by the vaping industry. And so 2 of our trainees have already presented this information to a group of parents at our local community center. And they said that went successful. I think they've had maybe like 60-ish parents there at the community center. So that was a huge turnout. But people who have trained, there's the elementary family resource and youth service center coordinators and their staff, a lot of school staff. We have the Green River District Health Department staff. I saw Gary Hall and Ethan on here, so shout out to them. We did train some other RiverValley behavioral health staff at our community mental health center as well. And then the community center, the Neblet Center, that's where they had their parent training as well. And then one interesting partnership we have gotten out of this is the Port, which we have already established that relationship because they are a RiverValley behavioral health site, but it is a tailored program, and they were wanting to expand into hosting parent engagement nights. So the youth that come to the Port, they are already engaged in prevention activities, and we proposed, hey, you're already engaging with the youth. Why don't we kind of bring it as a holistic approach and get the parents involved in prevention as well? And so they have plans to host their first parent engagement night. And then we have also trained the Recovery Resource Club in Henderson County. And I believe they are going to train their parents in their support groups as well. So it really goes hand in hand with other programs that are already happening in the community. So it's a perfect segue into prevention messaging. We've hit the road with this. It's been very receptive. A lot of people are wanting parent engagement nights and needing curriculum to train with. And so we've had a lot of successes, but these are just a few. And I love that video that Kaitlyn has let us watch. And it gives me ideas on what we can do in our region. And that's what PAVe is really about in our community. We want to build the capacity so then we can lean on each other and talk about what's happening and give that resource back to the community. And whenever there's a training coming up, I can rely on Gary or Ethan or somebody else at our regional prevention center. Or even the elementary school. It's very, very nice to have everyone trained in it, so then we can all see each other, train with each other, and outside of our disciplines as well. So it's a great collaboration that we've seen. And so I have my email up here as well, but my coworker, Heidi Wilson, is also a trainer in the RiverValley region as well. And I think that's all of our successes. I know there's more, but I could probably spend a whole hour on this. So thank you for your time today.
Thank you so much, Kayley, for presenting and for sharing your successes. Again, it's really encouraging to hear it, and I'm glad that we were able to share these stories with you today and to talk more about PAVe as an organization and the work that's being done specifically in Kentucky. So with that, I'll say I hope to, or I know we will, bring you more positive updates in upcoming months. And I will turn it over to Curtis, and we'll do a Q&A.
Am the epidemiologist for the program. I'm Curtis Flynn, and I'm quickly filling in for Ellen Cartmel, who was going to moderate the Q&A but had to step away. So anyone who has any questions for any of the speakers, please feel free to unmute or add it in the chat, and we can direct those questions to the correct person. Thank you, Gary. Looks like Gary Hall from Green River had a question in the chat. He asked, does the PAVe program meet the requirements of House Bill 142? Alexis, is that a question that you can answer, or Jackie?
I'm going to turn that one over to Jackie.
Sure. Thanks, Gary, for the question. So that's kind of tricky, I think, in a way. Yes, it would be a great way to supplement the requirements of House Bill 142. The language and the way that House Bill 142 is written isn't really clear and possible in some situations. And so the segment, and I don't have it in front of me, so I'm not sure of like specific numbers or sections, but the part that talks about providing information to parents on prevention and cessation resources and materials, I mean, this would fit that perfectly. I can't really think of another part within House Bill 142 or that new statute that it would apply to, but yes, it would cover the basis for that that parent education piece. So great question. Thank you. And I was going to also ask, I see Alexis has put the recommendations and resources guide in the chat, but Gary or Ethan, not to put you all on the spot, but Kayley mentioned partnering with you all. And so I just wondered if you all could share a little bit about what that partnership looked like you know, and how you all promoted it with, you know, from the health department aspect.
Well, this is Gary, and certainly we participate with our local, you know, the Regional Prevention Center on so many different programs and initiatives. And this is something that we've played a supporting role. They've really taken the lead on it. And like Kayley and Heidi have, you know, already done, they've really marketed and reached out to the schools and to the community, and just done just an amazing amount of work in that area. And we've basically played a supporting role. Of course, you know, we're see each other at coalition meetings and ASAP meetings and school meetings and advisory council meetings. Also, something else that probably is kind of moved them forward with a lot of different counties is that they have actually an adult leadership coalition meeting, and that adult leadership is something that Regional Prevention Center started several years ago, and they actually have a summer retreat. We've had it at, they've hosted it at Lake Barkley, where they've brought in outside of the state trainers to come in and give really useful information and ideas to our community leaders. And so I think that's been another engine of that adds excitement and support to the effort. And so you know, again, you know, I think the health department is you know, engaged and involved and share like goals and objectives with the Regional Prevention Center, especially around tobacco and nicotine prevention as well.
That was great, Gary. Thank you so much for that input. And Kayley echoed what Gary said in the chat. She said that they lean on each other primarily through coalition meetings and encouraging members to get trained. So that's really positive and really good to hear.